Mrs. Johnson. Do you mind if I come in? Hi. My name is Bethany, and I'm from the Respiratory Therapy Department. It's so nice to meet you, Mrs. Johnson. I was just coming in to check on you because it sounds like you're having some flare-ups with your COPD. Now, it looks like in your chart here that we have you in here because you're also having some heart issues. So it looks like the doctor has ordered some medications that'll kind of help with that. And you can get comfortable. So, the first one that we're going to start with to help with your COPD is we're going to start with a Salmeterol, or you might also hear it called Ceravent. And this one is to help open up your airway. And this one, it has less side effects than the Foradil that we had you on earlier. This one has it's easier on your heart. It's a little, it kind of affects it less, so you won't have that heart racing and all of that. So we're going to give you this one. This one you're going to get 2 times a day. You're going to get it every 12 hours. And then the second one that we're going to give you is called Levalbuterol, or also called Xopenex. And this one, again, is a little bit better than the regular albuterol that we had you on, because it's again, has a little bit of a less side effect on your heart. And this one we're going to give to you in a nebulizer treatment and in a rescue inhaler, in case you need an emergency treatment like that. So first I'm going to start off. Do you mind if I listen to your lungs and take your heart rate? Awesome, thank you. Here, let me fix your headband for you, ma'am. So you're going to have to take a few deep breaths for me. Perfect. I can just listen to your pulse. Great, that sounds great. So the first one that we're going to go ahead and start with is the Ceravent. And so this one I'm going to give to you, like I said, in that dry powdered inhaler. And so what I'm going to do is I've already punctured the capsule in here, and so I'm just going to have you take a big deep breath in. And then it's going to take, if you can inhale for about 10 seconds, and then hold it for about 10 seconds or as long as you can. So if you can exhale completely and then take a big deep breath in. Great. Good job. And then I'll go ahead and have you rinse out your mouth. And then the next one I'm going to have you do is the nebulizer. And again, this one is the Xopenex, or the Levalbuterol. And so I'm going to put this mask on you, and I'm just going to have you breathe normally. These treatments usually can last about 5 to 7 minutes. So just breathe normally, and every once in a while, if you'll take a big deep breath in and then just kind of hold it. I'll put this on you. Good job. And then the final one is the rescue inhaler in case you do need it. So I'm going to give this one to you with a spacer. And so you can just store this at room temperature. Make sure to shake it really well before you use it to kind of mix everything up in there. And then you just pop the cap off and place it in the back of this spacer. And then this is the cap that you put your mouth around. Make sure that you put this over top of your tongue so it doesn't get in the way. And then as you activate this, you're going to press down and inhale at the same time. And then hold that in your lungs, kind of let that settle, again, for about 10 seconds or as long as you possibly can, okay? So some side effects that you might have with these are dizziness, headache, some throat irritation. If you have any of these, please let me know, but those are pretty common, okay? So now that we've done that, I'm going to listen to your lungs again. If I can have you take a big deep breath and cough for me. Awesome. Let me listen to your heart. Take your pulse here. Great. That sounds so great. It was so nice to meet you, Mrs. Johnson. Do you need anything else from me before I go, or do you have any questions? All right. You have a good rest of your day, ma'am.